We're here at the IAS meeting. We're here with Abdusamad, who is with the Stop TB Partnership
Tajikistan.
in Tajikistan. And we really appreciate you taking the time. You just got done with the press conference, and there was always this sadness that comes from the lack of willingness to support health issues in Central Asia. Where is the worst of it? Is it in your country, in Tajikistan, or is it?
So, as for East Europe and Central Asia, nowadays there are certain barriers that makes the TB and HIV treatment extremely challenging. So the first barrier is the high migratory flow, which is people are coming, going, and so the risk of getting infected is high. The second is that the external funding for TB and HIV is really crucial. So many efforts has been done and we have progressed in somehow, but still if the governments don't step up to increase the funding in the next few decades, so the rate for HIV and TB is going to be very high in East Europe and Central Asia.
Is there a real financial consequence by not treating the people in that country for the government?
So as of now, the government, the Global Fund is funding the Tajikistan. Well, from the 2017 start, they start to cut some fundings, and the government for the now is taking the first line of sponsoring or financing the first line of medication for the regular TB, and for the rest, they will try to get it from the 2017. But I'm thinking that till now, even though we are getting a lot of efforts, a lot of support from the Global Fund, still we cannot fill all the gaps which needs to be done.
So I guess the question I'm asking though is that if people are not treated, does the government suffer? I know the people suffer, but does the government actually suffer because they'll have to do something like hospitalization, or or do they not even have access to the hospital?
No, the government actually doing. So according to the last WHO, the WHO for strategy for treating the MDR patient, the government actually really suffer if you don't treat the patients. You don't treat the population, because it is going very high, and very soon it can cover all the population. Well, the government is providing the hospitals for the MDR patient, but it's going to be only for the 2-3 months. So then the rest of the treatment will be done in ambulatory at home, and the medication will be daily.
So
the medication
there is a consequence.
Yeah.
So it makes obvious sense that they should be, somehow or another, get the leadership to talk to the doctors, the scientists, World Health Organization, Global Fund. It's just not acceptable that we have to lose lives and have people suffer and still have a financial burden that's more than it would be otherwise. It just doesn't make sense.
Yeah, that's true. Actually, the political will is much. This TB and HIV, I would say this is a social disease and made worse by poor political will and commitment for its control. If there is a political will there, of course, we can reach more.
So we just have to build that political will. And that's your job. And our job to do with you what we can do.
So as of now, and we are also working on raising the awareness of the general population about this disease, the measure of preventing from the disease, and also to convince them that for the patients, the social support is must. So as a neighbor, as a relative, as a doctor, whoever is there, they should support the patients so that the treatment adherence can be followed.
We're really all in this together.
Yes.
It's all one world anymore. I really appreciate you taking the time with me to explain this and the impact.
Thank you.
And it's really, sadly, as you say, we go back
Yeah.
and maybe nothing gets done.
Yeah.
but we really have to try to change that. We have to
Yes.
make it, action needs to happen.
Yeah, that's true. Yeah, we have to take an action now. This is the place where we can. I mean, all the networks, all the organization, all the things started in a room like this. So I think and I hope that after this AIDS conference, there will be some change and we will take some action. We have to place much more focus on the fight of TB and HIV.
Appreciate it. Thank you
Thank
very
you
much.
very much.